Hello, and welcome to Health and Fitness Redefined. I'm your host, Anthony Amen. Join me today as we take a dive into the world of health and wellness. We're going to overcome adversity, depict fact versus fiction, and see health and fitness in a whole new light. And welcome, ladies and gentlemen, to the final three-part series all about the COVID vaccine, the mandates, everything that's going on. We have an amazing episode today. And I know I say that a lot, but I think this one is one for the money, and all of you should really listen to this one all the way through. So without further ado, I'd like to welcome two guests to the show today. We have Donna and Jen. Donna, we're going to start with you. Just tell us a little bit about yourself and what you do.
Mm-hmm. So thanks for having us. I'm really happy to be here. I am a registered nurse for 30 years. My entire practice has been focused on maternal child's health and primarily neonatal ICU. I did study midwifery for quite a few years on the master's level. And I'm really just a Christian American patriot at heart. And that's really why I got involved in what we're doing here today.
Absolutely love it. And Jen, same question.
Hi. Yes, thank you for having us also. I've been a nurse for almost 20 years, a registered nurse. I'm colleagues with Donna. We work together, and we both do the neonatal ICU. And that has also been primarily the majority of my career. And I also, me and Donna also, are co-founders of New Yorkers Against Medical Mandates, NIAM Inc., which is our nonprofit that we started. And I also am just a concerned citizen for first and foremost, and just very, we're working very hard to get a lot of things done.
Yeah, we got a lot of information to cover. And
Yeah.
I know part one, just as a reminder to everyone, we had a doctor of neurology talk about his point of view and all that. Part two was talking about what was going on in the hospitals during COVID, and then the mandates that hit the medical field. So we're going to start and jump into a really juicy topic, and that is all about kids. And you both said you work neonatal, so you do deal a lot with infants. You both are your parents, correct?
Correct,
Mm-hmm.
yes.
Awesome. So Donna, we're going to start with you. Governor Hochul actually today has announced that prepare kids ages 5 and plus to get vaccinated. California has already pushed out rulings stating that kids need to be vaccinated before going into school. So as a parent, first and foremost, walk us through how this information feels for you.
It feels very invasive to my parental rights. The fact that we're fighting these things at this point is still unbelievable to me in moments. The media is so complicit, and they're truly guilty of pushing forward a narrative that's not true and manipulating truths for these large companies and for the government. And so, the majority of the American population, I would say, believe that there's an FDA-approved vaccine available to them, and that is an absolute falsehood and lie. There's a legal case going forward right now to show that. It's on Pfizer's website. If you go all the way down to the very, very fine print, which who does that, right? You hear the TV tell you something, you hear your government tell you something, and you believe it. And if you're somewhat skeptical, you might go on a website and look. And if overall the message seems to say what you already heard, the majority of people walk away and go, okay, it's true. But my own son, who's 17, a senior in high school, showed me on the website, oh no, Mom, you're right. It's not available. It's not being manufactured. So it's very disturbing to me that we have this very, very coerced method of manipulating the public on a grand scale from all different entities, right? Business, government, you name it, to take actions that are unprecedented, to mandate vaccines for any human being in our country, but especially for children, who, we're supposed to protect those who can't protect themselves, right? Parents are supposed to be their children's advocate. That's our duty. It's our responsibility. And as nurses, it's always our responsibility to be our patient's advocate. And that's why we sit here today. These vaccines, while the technology is not new, the vaccines are new. This technology has never been injected into human beings before. If you look at all the fine print, we are human beings that are being injected right now is the third final phase of the study. So how do you mandate that? And how would you, in good conscience, allow that to happen to your child? You're part of an experiment. Who would do that?
Let's talk, switch it over to you, Jen. We kind of got a little understanding of what's going on. I want to talk about the hospital perspective for just a little bit. So through your experience at the hospital, even pre-vaccine, what are the kind of COVID cases you saw? What was the impact it had on kids, or maybe personal stories that you may have had?
So we're in the unique position that since we work in the neonatal ICU, luckily we don't see every day on a firsthand basis COVID patients. That being said, in the beginning, I would say, back in late March, April 2000, what was it, 2020? 2000, I don't even know what year it is anymore.
Most people feel that way.
2020, it feels like it's been 10 years. In 2020, the hospital basically, it was like all hands on deck. So it didn't matter where you worked or what your specialty was, you were floating to a COVID floor when they needed you, which was terrifying in the very beginning because we were all faced with this unknown because, it was something that, hey, like the news is telling us this is like really scary. We have to all be scared. So we were all very frightened, and we helped with first we would go to the pediatric ICU, but there were no real pediatric patients there. They were taking care of, I would say, like young adults, like maybe not like the elderly patients, but like maybe 20s, 30-year-olds, COVID patients that were all pretty much in the very beginning, all vented really in the very beginning before I think they really knew how to treat it correctly. So there were in the very beginning a few teenagers, I would say, I would think that were seen in the PICU that were COVID positive, that were on ventilators, but they were extremely overweight, very like morbidly obese teenagers. They were young. It was very unfortunate that they were in that predicament, but they were not healthy. Your healthy 10-year-old, 11-year-old, 15, 16-year-old child, they were diabetic, overweight, and so that's why they ended up being so sick and unfortunately. But since then, since that first wave in the very beginning, I don't think I haven't seen personally any children being severely adversely affected by it. Are there positive COVID cases in children? Yes. What does that mean? It's different in every case, obviously, but there haven't been any extremely sick children that I've seen personally.
I want to bring up an interesting point, something I know from firsthand information, and then Donna, you can kind of talk about it maybe a little bit more. Jen mentioned a point, they were intubating people really early, and that was the cause of a lot of deaths and severe illnesses because they didn't know what was going on. Not to say maybe it was the hospital's fault or whatever, but no one knew how to treat it, so they just figured, hey, get him on a ventilator and hope for the best. Mm-hmm. The hospital then sent out a memo about 8 months later. I'm not going to mention the hospital, but they stated, hey, it's our fault. We shouldn't have been doing this. This is how you're going to treat patients going forward. And the survival rate skyrocketed after that. Any truth to this or something that I saw from the hospital firsthand or anything that your hospital maybe sent out?
I have no knowledge of our hospital sending any kind of memo or message out like that, but I do have many anecdotal stories, firsthand stories. So, many members from our group and organization that come forward and tell us unbelievable stories. One respiratory therapist who came out of retirement after 40 years in practice to help during the pandemic. And I mean, she had me on the phone for about 2 hours telling me horror stories. And she actually got to a point where she refused. And if doctors wanted to intubate, she said, do it yourself. And, and she's not alone. There are many stories that I've heard from people who were in that position and realized what was going on, was not okay with it, and decided either they needed to step away, they weren't going to blindly follow, or some that carry a lot of guilt because they continued to do their job, felt like they had no choice, and look back and feel that it was the wrong thing to do. On top of that, there was, the remdesivir that was being given that has a lot of kidney toxicity. And once your kidneys go, you start to fill up with fluid, and then you land in congestive heart failure. That's what a lot of these patients died from.
Congestive heart failure from the medication.
Yeah.
Interesting enough, you bring that up, actually. Do you feel in medicine and hospitals that it's become politicized in the sense that I remember back from 2020, I'm going to pronounce the drug wrong, but hydroxychloroquine was something that we were supposed to use, but hospitals didn't want to use. Any understanding from the hospital saying, hey, don't use this kind of drug? And I know now with ivermectin, it's kind of the same scenario.
I don't know. I mean, I personally haven't been like privy to any real documents or papers, but again, heard a lot of stories, hearing from even just family members of people that want to use certain medications or asking for it, and basically hospitals basically flat out saying, no, we can't use this. This is not our protocol. No, our protocol is remdesivir, high flow oxygen, steroid use, and even the vitamin C and the zinc and the what is the other thing? I don't know. I can't think of what it's called, but it's okay. But so there's a lot of so basically this is our protocol and that's it. So that was formed pretty early on, that protocol, and I don't think there's been any real trial of anything else. And it's a shame, and I do think it's politicized, and I do think a lot of this is about money. And politics, and if you have to do it this way, because I feel like healthcare is changing, and it's making me very sad. And I've been doing this for almost 20 years, and it's very hard for me to go to work every day because I feel I don't want to be a part of this anymore, of the system, because I feel like we're failing people. I think that the general public is being fed a lot of lies and a lot of misconceptions, and it just breaks my heart because I don't understand like why we just can't try other things.
I want to go to Donna off that point. Sure. Actually, exactly. We did a podcast episode 8 months ago on childhood obesity, and it's something you mentioned was the real big underlying cause. And that, if you want to go hear about that being politicized, go just listen to that episode. We talked about that for about an hour and a half and really dove into it. But should, instead of maybe pushing a vaccine, what if we focused on curing childhood obesity? Talk to us as a parent and as a nurse from that situation about what you would do.
Well, yeah, listen, I think the best medicine is always preventative medicine, right? Honor your temple and your body. You only get one. And you are certainly at increased risk by increasing bad behaviors, okay? And as a society and a culture, we have not really fed into, healthy lifestyle for kids. They're more sedentary than ever. The diet, even, the pyramid that we learned growing up, I don't necessarily think that's accurate. I mean, and to get the calories that you need to be really healthy as far as nutrients in a day from food, most people could never attain, right? So yes, talk about proper eating, the right kind of exercise and activity level, and engaging in something that you feel fun and passionate about, that's healthy for you, and also supplementing, quite frankly, because we cannot possibly eat enough to keep our bodies 100% healthy. It's just not possible, and to be able to fight all those things off. So I think as a mom, I definitely try to do that with my kids, and thankfully none of my children are obese, and they do for the most part take care of their bodies and temples. But, I agree with Jen, like this has been so politicized, and it really does always come back to money, right? Whether it's, if you look back at the history of McDonald's and how they opened up next to a school, and, it's just, and the farming practices and the government's influence over farmers and agriculture, and and where the money comes from and who gets grants and who doesn't, and get things subsidized. And, so when big business has such a hand in government politics and politicians are no longer public servants, but they're self-serving and serving big businesses, we have major problems. And not just in this, in every area of our life and world. And so this is just another symptom of a major problem. And, for me personally, I have spoken with practitioners and people, just going back to what you were asking Jen about a little bit, the AMA and different organizations that pressed physicians, from the government, from the New York State government, letters that went out to providers to say, we don't really want you writing medical exemptions, right? So at this point now, the government is getting in between you and your long-held, sanctified, private relationship between physician and patient. When has that been okay? So a doctor who thinks their patient has a big clotting risk, let's say, isn't allowed to say, I don't think you should get these vaccines. They're clotting issues, and this could be really detrimental, maybe deadly to you. And the same thing happened with the filing and filling out of death certificates. I mean, I know these are things that people have heard before, but they're true. And so, it has been extremely politicized. I'm not going to sit here and think that I know why. I have my own thoughts and opinions on that. It doesn't really matter why. I just know that it's wrong, and it needs to be corrected. And people need to start taking a step back and recognizing like how quickly we've gone this far, and start thinking about how we can wind back, and in what areas they can do something personally to help that happen, because where we are is not okay, and where it's leading us is really terrifying.
I couldn't agree more. And Jen, I want to turn over, just talk a little bit about the vaccine itself on kids. So we know from the previous episode we spoke about how it's a spike protein, and the COVID is, and then the vaccines and mRNA is supposed to help A, B, C, D, E. I'm not a doctor. I'm not going to make this stuff up the top of my head. But have you seen anything with kids getting vaccinated? Have there been any stories that you guys have heard? Because I know you talk to a lot of doctors and nurses all the time, from side effects that they may have had, or is it worth it? Is it worth the risk of getting a vaccine over just contracting COVID, and who knows?
So basically, I think that's a good point, because I don't think you have to be a doctor or a nurse or a medical professional to be skeptical about this, because I think that if you just use some common sense and some critical thinking skills, that you can realize, like, well, wait a second, this is, like you said, not new technology, but the first time we're doing this on a wide scale, basis, this type of vaccine. We haven't had studies on adults, let alone children. And, we don't really know what, the future will hold for them. And there are things now after the fact, after the rollout of, vaccinating, 16 and up, right? Oh, wait a second, now we're going to start studying the menstrual effects, of like the effects that it has on menstruation in young women, or the myocarditis in young men. So it's almost like an afterthought. So to me, as a parent, I would think that's like a major red flag. I mean, if you're over 18 and you're considered yourself an adult and you want to, make that decision, that's fine. But going back to what Donna said before, when you're a parent, you're an advocate for your child. And I personally don't feel comfortable injecting, having something injected into my children that can't be removed, that's not going to wear off, and that we don't really know what's going to do to them long term. Because you know what? When the Gardasil vaccine first was introduced, there was a major pushback from parents, major. And they wanted, there was a lot of, I know I've personally been in some PTA meetings where, they were talking about, this was years ago, before COVID, about vaccine mandates, mandating flu vaccine, talking about the Gardasil vaccine, and parents, there was like major pushback from that. So I just want to know, where is the uproar now? And I think it's going to be coming, because I think as soon as something's really official is said, especially in New York State, I think that's where you're going to see the big pushback coming from parents. But it's just really, in the hospital, I don't know. We don't, you don't know what you're seeing in the hospital. Have there been any children admitted with any type of adverse effects? I have no idea. But I have heard stories from members and from just people I know in general. Like, they got the vaccine, a week later, X happened, or they got the vaccine, a week later, Y happened. So we don't really know. And I think that's what's really scary. So I don't understand what just boggles my mind this whole time has been, what's really going on here? Like, why are we in why is there such a push for this? Like, why? Like, I feel like the solution to the problem doesn't, there's no justification, because it just doesn't match up to me. Like, in my head, when I use my critical thinking skills that I have, it doesn't match up to me in my head. Like, this response does not match up to what's happening. So why do we need to have all these kids 5 and up vaccinated? Why? I don't think that anyone should be mandated to be vaccinated, but especially our children, because we don't really know. So what happens in 10, 20 years and we find out all these detrimental side effects? So, oh, well, too bad. It stinks for everyone who got it. Like, I don't know,
And that's kind of leads to my next point, which you can kind of reference a little more. A lot of people that maybe feel the opposite way, the question they're going to ask you is, what about all the other vaccines that are mandated for schools? I know personally, I had to get certain physicals and vaccines for high school and stuff, and then into college, it was the same thing. I needed to be up to date on XYZ for certain vaccines. Any thought to the comparison there?
Oh, absolutely. So first of all, we're not anti-vaccine. We've never have been. We're both vaccinated. Our children are vaccinated. And most people that you speak to that are on this side of the argument, our side of the argument, are not anti-vax. There are some anti-vaxxers out there. So I need to just state that really clearly. The difference here is, first of all, I disagreed with New York when they rolled back the exemptions allowed for school-age children from a constitutional standpoint. But beyond that, there are many, many factors here. Going back to the fact that this is new use of technology. We are the experiment. With the Nuremberg Code, you have to have consent. Somebody has to agree to that with fully informed consent. We do not have full information, and you're mandating people and stripping them of their right to earn a living or participate in society in some regards, and discriminating and stigmatizing people for wanting to make an educated choice for themselves or a religious personal choice. Like, that's not what America is. And so, comparing it to the other vaccines, I don't think you can. Other things that have been mandated for school-age children or for all of us, you can't. It's like comparing apples and oranges. And, when you really do look, the VAERS reports and the CDC reports.
What is the VAERS reports? Talk to some of us don't know.
So VAERS is a site. It's been around for, I don't know how long, but forever. It's like a standard. It's nothing new. It's a self-reporting site. And quite frankly, a lot of practitioners, physicians, physician assistants, nurse practitioners, nurses really didn't know much about VAERS before all of this started. They didn't even know that they're mandated to report. Okay. But it's a site where you can go on, and if you admit a patient, treat a patient, or you're a patient yourself, and you take a vaccine, a medication, and you have side effects, what you think are correlated, or you see something clearly happens after that.
An adverse reaction.
An adverse reaction,
yes.
An adverse reaction, you report it. It gets reported. Physicians are supposed to be reporting it. It's not happening. In some cases, they're too busy because it takes almost 30 minutes per patient to fill it out. Or they've been kind of instructed to ignore it because, let's just say, let's say you end up with an adverse reaction after your first dose. That's not considered vaccine related because you're not quite vaccinated yet. If you get it within 2 weeks of your last dose, that's not considered related. It's not reportable as related because you're not fully vaccinated until after 2 weeks after your final dose. The problem here is, and this is going to just a little bit wind back to something Jen was saying about, the means does not justify, I'm going to say this wrong. I can't get it. The ends are not justifying the means, right? And they don't correlate well to the beginning, because all of the data is skewed and inaccurate. And that's what the media has been fed and told to push and pushed to the public, which has created fear, which has allowed these things to go forward. The testing was wrong from the beginning. CDC admits it. And if you want to say it was political, it wasn't political. It just so happened that they corrected it right after inauguration, like literally 1 or 2 days after. That PCR test is set at specific cycles. And everyone who knows knew it was being amplified at way too high a scale, which gives you immense false positives. So now your infection rate is wrong, right? Your total case rate, which would then lead to your infectivity, like, oh, well, I have something now, I just gave it to you. These could have been false positives. A lot of them were. And then on top of it, with the death certificate issue of how they were doing that, part of it was because it was incentivized, right? Hospitals got money for every $44,000, I think, per patient on the ventilator for COVID, wow. And money for, COVID death-related issues. So whether it was a monetary thing, a political thing, I think it was a big combination of a lot of things. But when you have all this data from the get-go that's been wrong, and you still have, depending on your age and category, a 97 to a 99.7 survival rate, what are we doing here? Where is the justification to use human beings against their will, at the coercion of being forced out of like civil society and stigmatized and not be able to provide for your family and work, in an experimental drug? That's where we're at. That is 100% where we're at. And people need to start saying it. They need to start understanding it, and they need to not be afraid to speak up and to start take a stand, because this is just the tip of the iceberg. No government, as you said earlier, no government gives back any power and control once they have it. It doesn't happen. Look at history, and the history is not far behind us.
It's something, great segue right there. I loved the energy behind that a lot. But I'm going to segue this kind of what's going to happen in the future. Jen, I'm going to turn this over to you. Something that was pushed out through Governor Hochul a while ago was saying that if there's a shortage, or when there's a shortage of nurses, doctors, and staff, the National Guard's coming in. Mm-hmm. The National Guard's then going to work in the hospital. This is public information. You can go look it up. Mm-hmm. Ironically enough, I don't know the exact date, but I do know National Guard has until, I think, spring to get vaccinated. So your big call to pushing out RNs and doctors that are unvaccinated, because now the hospital is 100%. Once the National Guard comes in with who isn't mandated, then those numbers then get skewed again. What does this mean? Where is this going?
I don't know. It definitely is a real slippery slope. I mean, I think a lot of people, once I know that once the governor came out and said that we'll just use National Guard members to fill, first of all, the National Guard, most of those people have day jobs, right? So you're going to probably, and the people who are medically trained probably have a day job in a hospital already somewhere. So I think it's really funny how those people, you're gonna take the people from one hospital that they work in during the day and make them go work in another hospital. So the logic there doesn't make sense to me, because the National Guard is not like I know you're on call for a certain amount of time, but then you leave your job to go do your National Guard duties. Mm-hmm. So it's not like she's calling in like people who are like full-time like Army workers, Army members that are going to come in and do it. But that in and of itself is very scary to me, that you're having the National Guard is going to come in and just take your, fill the positions. But I don't think, so basically I don't think her logic doesn't really hold any water, really. I think that, again, critical thinking skills. I keep going back to critical thinking because I feel like it's really important. And I know a lot of people don't possess them, but I think that that's the problem. And I think those are the people that are being preyed upon, right? The people who don't have any critical thinking skills. Because I think that if you really just take like about 10 minutes and think about it, like the whole thing kind of just doesn't make any sense anymore. And if you ever have a conversation with somebody, you say, just wait a second, just hear me out and just listen to this. Does this make any sense to you? And like, well, no, it doesn't, but still, so like that to me, like, that's not really a good reason. But again, as far as the National Guard, yes, they're not mandated, and I think it is like June or something that they have until. So you very quite possibly could have still an unvaccinated healthcare worker caring for you or your family member. So the reasoning that a lot of hospitals are giving for denying, religious exemptions and for not, allowing people to continue to work when they're unvaccinated is that, well, you're putting your patients at risk. So that to me right there is like, it doesn't make any sense to me, because you are putting them at risk if you have other people that might, it doesn't make any sense.
Right. I want to just add something to that. Just the fact that vaccinated people are still contracting COVID and shedding and spreading COVID, and that they have the potential to do so almost at a increased risk and rate, because if the vaccine works the way they want it to work and it diminishes your symptoms, so it's not a vaccine in the true traditional sense, and it doesn't stop you from getting it, and you have to get it to then launch an actual immune response.
Right.
And so you're going to have hopefully less symptoms maybe. So then now you're walking around completely unaware, right, that you have anything that you're spreading, and you're not taking proper precautions. You're not saying like, you know what, I'm not feeling quite right. Maybe I shouldn't go see grandma today. Maybe I shouldn't be at the grocery store. Maybe I shouldn't go on that play date with the kids, whatever it is. And let's also just say, just regarding healthcare workers, they're all still wearing PPE, vaxxed or unvaxxed. So if PPE works, why? And PPE worked through the whole pandemic, where there was no vaccine. Why is that not sufficient now?
It's the kind of the question we drove home last week was,
right,
if PPP worked, then what's the issue? But
right,
a big thing I get from a lot of people is that, and I want you to kind of talk about this one, it's the unvaccinated that are getting the vaccinated sick. And if everyone just got vaccinated, then COVID will no longer be a thing, and we can all go about living a normal, healthy life. Want to add to that?
No. Well, first of all, that's not true.
It's not true.
Because that's not, if you ever took any type of biology course ever, that's not how germs work. Germs will always continue to look for a host. So it's always going to continue to mutate and change, and it will always look for somebody. So yeah, that might make sense. Like I think a lot of people think, well, it's just like measles, or like we'll eradicate it. We'll eradicate it if everyone gets vaccinated. But that's not going to work, and especially not with a virus, because the flu is. It has never been eradicated.
And it's a flu shot, not a flu vaccine, by the way.
Exactly. Although last year the flu didn't exist, so
right.
So maybe it is eradicated. I don't know, but but it's not true. Like that's not gonna happen. Like if everyone got vaccinated, COVID is here to stay. Basically, we have to all come to that. It's endemic now. Like it's here. It's going to continue to change, and it has continued to change, right? And usually strains usually do weaken, usually as they continue to mutate and change.
Becomes like a common cold,
right? And I think that doesn't fit the narrative, obviously. So we have to continue the fear mongering and continue making shoving it down everyone's throat every night on the news about how scary this is. And you know what? You don't vaccinate your kids now, they're going to kill grandma, basically. That's basically what they're going to say. And so your children are really being used as a weapon now, because you're saying, like, if you care about your kids, your family, your elders, your society in general, you have to be vaccinated, basically, is what they're saying. So, and if you don't do so, you're bad. And that's what the people who are just like, maybe they just want to wait. Maybe, because I'm going to tell you that I started off last year when this vaccine came out. I knew that I wasn't going to rush to be the first one to get it. I knew that. Like, that wasn't my, I just from what I had seen in the hospital with COVID personally and personal experiences with people I know, I was like, you know what? I'm still not convinced 100% that I need to get this right away. So I was like, I'm going to wait. And even my parents were like, oh, you should get it. You should get it. I'm like, no, I think I'm going to wait. I just want to see how it goes. Like, I don't think there's anything wrong with, thinking that. Like, let's just see what happens. Let's give it a year. I mean, I don't think that's crazy. Like, to me, like, I think that was like a reasonable, rational response. But if you are that scared and you are at high risk and you really feel like it's going to benefit you, fine. I have no problem with that. I have no problem with anyone who wants to be vaccinated. Just like I have no problem with anyone who wants to wear a mask. I don't care. You do you,
Yeah.
I will do me, So, and that's the American way. But so basically that's how I started off. But then as things started unfolding, and I just like, this is like so odd to me, like that there, you can be entered into a lotto if you get the vaccine. You can get free French fries if you get the vaccine. You can get,
Can I just stop you right there?
I know, crazy. It's crazy.
I did hear about the fast food incentives that were pushed out.
Yeah.
And
Yeah.
I'm going to go back to a point you mentioned about 20 minutes ago.
Yeah.
It was the morbidly obese
Yes.
population.
Yes.
Even, I think it said it's 71% of people who died were morbidly obese, but were incentivizing a vaccine with fast food.
Right.
So that in and of itself
Yeah.
is like red flag, what is going on here?
Right.
Very odd to me. So it just, the more that it was being shoved down my throat, the more I got turned off by the whole thought of it, basically.
I want to add to that, just in regard to, that this is a disease now and a pandemic of the unvaxxed. If you start looking around the world and looking at studies like in Israel and some other places, that's not the case. And there's a lot of data and science and research out there that, never comes to light, is never shown on mainstream media, but it's there and it's valid, legitimate research and
Because
data.
it doesn't fit the narrative.
Because it doesn't fit the
why.
narrative. But
That's why.
that shows that actually we've never vaccinated in the midst of a pandemic. And doing so actually causes more mutations and more virulent strains, whereas it would normally become less powerful. This can cause further problems. And so, the narrative that it's a pandemic and a virus of the unvaxxed now is untrue. And that's like the latest propaganda being peddled by media and coming from the government and from big business. And it's just to get you to be coerced and cave into doing what they want you to do. Be a good little listener, be an obedient little sheep, and you do as you say, and you'll be able to enjoy your little life, your French fries, your job, and your theater, and anything else you want to participate in. So, I also want to talk about how serious are we as a nation about anti-discrimination? How serious? As a nation, as a world population, how serious are we? So, this is just the latest form or group to be discriminated against, except instead of it being a particular race, religion, nationality, now it's somewhat an ideology, but it's really impacting everyone across the board. There isn't a socioeconomic group, there isn't a race, a religion, a creed, a nationality, and anything that isn't being impacted by this. And quite frankly, if you're really serious about racism in America, you should really be concerned about these mandates in New York City, because it's overwhelmingly impacting the Black community. And that's why, for the first time, you're seeing BLM people coming together with Trump-wearing hat conservatives and saying, oh, heck no, not on my watch. Let's talk about why does the Black community maybe as a larger whole, not trust this. Let's look at recent history. Why should anybody trust it?
Great point. I mean, that was a lot of information to kind of take in right there. But I just, only to briefly talk about it for 30 seconds, is that I know New York City just announced that all businesses should now be checking vaccine status for anyone going in anywhere to even enjoy your life. And I know it is killing small businesses. Mm-hmm. For those that may think, no, this is great, I can tell you personally, the amount of businesses that are going to go out in New York City is going to blow your mind. I've seen it with gyms, I've seen it with restaurants, and this is something we talked about last year when we were doing our little shutdown segment. It's going to kill the fitness industry.
Yeah.
And that is not something, if this is actually maybe a pandemic of the obese instead of a pandemic of the unvaccinated, that might be a little better of a saying. And maybe if we didn't close gyms for 7 months, we actually opened them and incentivized people to go to the gym and work out and start getting more sunlight, then maybe many people wouldn't have died. So where really is this going? I know both of you are nurses and can agree with me. The number one killer still to this day is what? Cardiovascular
Well, cardio.
disease.
Yeah.
By
and
far.
mostly preventable by life choice.
Mostly prevented by life choice. That blows your mind. If you're really concerned
Yeah.
about COVID, you should be concerned about cardiovascular disease. That's my 2 cents. But anyway, where are we going with this? What's the future? What's going to happen in a year, 2 years? Let's kind of summarize this all together. What's the bigger picture that's actually going on?
Well, I hope that more people, and I think a lot of people are starting to wake up. I think a lot of people, I think in the past couple of months, I think more and more people have realized, like, wait, like taking a step back and go, like, wait a second, like maybe this is not, we're not going down the right path here. Yeah. Not everybody, because, you know, we've all met people that don't agree at all and will not listen to anything. And that's okay, because that's their prerogative. Like I said, you do you. But, I don't know. I mean, I hope that we can't continue down the path we're going now. No way, we can't. Because, like I said, you give them an inch, they're gonna take a mile. So you know, we can't continue to go down this path because really, if government has this much control over us, that this is just the first step, and they're gonna be like, oh well, hey, they're listening to us for this. We'll just continue to go. We'll just continue on. We'll just continue to push our agenda, whatever that may be. And I think that if people don't really just start saying no, like, no, I'm not going to do this. No, my children will not. I'm not going to vaccinate my children. No, I will not. I'm not going to comply with what you're telling me to do. Then, you know, I think it stops when people say they've had enough. That's what I think. That's.
Want to add anything to that? I see you're still just like,
Yeah.
Just chomping at the bit.
Yeah.
Sorry, Jen.
Right?
Listen, I've said this before in multiple different places to many people. I believe wholeheartedly this is the fight of our lifetime. And we are kind of the adults in the generation that we are currently in, the overlapping generations. We really haven't sacrificed anything. We've been really comfortable for a long time, really since like the World War II generation, right? I mean, and the Vietnam vets, and there are other people in there, but we've been super comfortable. And with comfort and ease comes complacency. And if you take a look at history and you take a moment to really think about, what does it mean to be a human being? Why are we different than animals? And why is the United States, and has the United States for as long as it's here, been a city on the hill for people to flee to flock to, whether it's to escape tyranny and fascism and communism, or just to have options and opportunity to pursue the life that they want. And if you believe those things, you are obligated. You should be compelled in this moment, regardless of whether you personally want a vaccine or not. You should be obligated and compelled to take a stand against what's happening, because I don't fear it, but I know that if people don't collectively do so, we are headed to a place that's very dark. And whether that takes 6 weeks, 6 months, 6 years, I don't think it's going to take that long, because look at how quickly we went from 2 weeks, everybody stay home, to flatten the curve so hospitals don't get overwhelmed, to where we are today, to presidential candidates saying, no, we could never mandate a vaccine. You can't do that. And what's happening. So I implore people to really be quiet for a few minutes and look within about what your core beliefs and values are, and then start acting where you find yourself, where you can, in that regard, that in a way that's true to your moral compass and your ethics and what you believe. And as a society, then that'll dictate where we land. And, you know, they always say, freedom is only one generation away from extinction, and it only takes good men and women to be silent for those things and tyranny to go. People make a lot of references to Nazi Germany, but it's for good reason. And I'm going to say it was doctors and nurses that stood on trial and were hanged and all kinds of things back then after Nuremberg trials. So we're not in unprecedented waters. History is repeating itself, and we have a very small window of time, I think, to stop it in its tracks and reclaim the America that we all grew up believing in.
That was perfect. And I just kind of want you guys to end with, you talked about call to action and what you're doing, what your group is about, and how people can get involved.
So we basically back in August, we started a Facebook group called New Yorkers Against Medical Mandates. And from there, we started so it started off very slow. It's a very grassroots movement, very organically formed. We started off a little slow, but then within 2 months, we have almost 24,000 members.
Wow.
So we have a lot of people that support us, agree with us, and then we started our nonprofit organization, NIAM Inc. And in order to we are collecting donations through this organization, but we wanted it to be very transparent. That was the thing. There was a lot of groups out there trying to give money to my GoFundMe or come support. So, but we didn't want to do that, because when we had all of a sudden when we started getting some real numbers in our group, we wanted to we felt like almost like a responsibility to them. We just wanted to make sure that we were kind of guiding them the right way. We didn't want them to these are people that might be losing their jobs at that point. We don't want to be here, donate money to this whatever. We wanted it to be very transparent. So we started our nonprofit, and in order to collect funds for legal purposes, and eventually we would like to provide some sort of financial support to people affected by the mandates. So that's kind of what our thought process was in that.
And I think the other arm of what we're doing is really just advocacy, right? We want to be part of where we can, shaping our community and our nation and our world in a light and in a way that is in line with our thinking and our beliefs. And so, it's one thing to be a keyboard warrior. It's one thing to say what you believe. It's easy to say things. It's a completely different thing to do something. And so, I would leave off with, a call to action. Do something. Not everybody is going to do the same thing. We're a body, right? We're a body and a collective group of people, and it takes every part of the body to function well, right? And so somebody, you have your eyes, your ears, your hands, your feet. Everybody has their role, their gift to bring, their community that they can bring it to. But I just would encourage everybody to stop, think, and then do something. Take action, whatever that looks like for you, but do it.
And they can get a hold of you guys. What was the website for it again?
NYAM.us. It's NYAMM.us. And we're in the midst of a lot of advocacy, bringing communities together, fighting for the same kinds of things, directing people who are needing help in the legal realm and connecting them with the right people and the right legal teams and lawsuits. And then, as Jen said, we really, our other hope is to be able to gain enough support. We almost envisioned it almost like adopt a family, we do that so often for people in other countries. And I think that's amazing. I've done it my whole life. There's a lot of ministry and charitable work I do and have done. But, sometimes you need to take care of who's in your back door, who's at your back door, your neighbor. And this is a time where we need to look out for our neighbors. There are single moms and dads. There are people in so many different circumstances who are taking the hard road because they are standing by what they believe. And we want to be able to support them if, the heating fuel is too expensive or they're struggling to meet the rent we live in a nation where so far we still have the capacity to be able to do that. And I think that's another way that people can get involved and help. You may not be able to create a platform like Jen and I have done, and we didn't do this on purpose. We landed here kind of on accident, but we're walking through it together, and it's not easy, but we believe it's important, and we'll continue to do it until there's not a need or an opportunity anymore.
Thank you, guys. And I'm going to close out a little differently. So we heard part 1, we heard part 2, and then we just had part 3 right here, guys. And I want you to take a step back and listen to the common denominator between all 3. Why it's important for me to do this on a show, a health and fitness podcast, to talk about COVID mandates and things that you may or may not take as political. And that's because the underlying response from all 3 people was the importance of taking care of yourself. If we all took a step back and decided, let me eat 1 less fry a week, let me have 10 ounces of soda instead of 20. These little changes can help make us healthier and actually help get rid of a lot of these diseases that end up killing us and, like you all said, overwhelm hospitals. So if we took care of ourselves, maybe COVID would have killed 71% less people. Cardiovascular disease wouldn't be killing over 500,000 people a year. Numbers would be way lower. Hospitals wouldn't be overwhelmed. Our health insurance would be cheaper. We'd feel better. We'd live longer. Our average lifespan, I've said before, for the first time in history, started 5 years ago. It's been going down. I want you to think about that for a second. 5 years ago, you go back and you were born, you had a better chance of living longer than your kids do. If this was really important, we really cared, we would take a step into the right direction. We'd start taking care of ourselves. We'd start pushing for things to go to gyms. Maybe the government should help give tax credits for people to go work out. Maybe there's different ways that insurance companies could pay for memberships. Maybe there's more of a way that way than there is to just describing the next medicine that's going to have some side effects to it. And then thank you guys for joining us on this week's and this final episode for COVID. Hope to see you all next week.